Hi, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, and I'm here to help you understand a little bit more about your dogs, spaying and neutering, and more specifically, how do we do it?
Dr. Lucas, how are dog spay surgeries performed?
So a dog spay is an ovarian hysterectomy, and it's done under general anesthesia. So here at our hospital, we're going to invite you to check in your dog in the morning time. We're going to ask you probably to maybe give some calming therapy at home so it's not so rambunctious when it comes in. We're going to help sedate it. We're going to do an IV catheter, put an IV catheter in your dog, and then we're going to get it under general anesthesia. And then we're going to prep it in the we're going to prep your dog aseptically, which means surgically prep it, and do an abdominal, so it's an intra-abdominal procedure. So we're going to go in the abdomen. We're going to remove the ovaries and the uterus down to close to the cervix. So that's an ovariohysterectomy. That's a spay.
Obviously, now we're going to go, how are dog neuter surgeries done?
I was hoping you asked that question. So a dog neuter is a dog castration. So we're going to do that. We're going to do that lead up to a neuter the same way. So pre-medications, sedation, IV catheters, get the dog under general anesthesia. Of course, we're going to hook monitors up, put them on their backs, and then we're going to surgically prep the penile testicular area, and then most veterinarians will make an incision just in front of the scrotum, and we're going to basically push both of the little testicles forward through that incision and then remove them, and then we're going to close that incision up. So that's a neuter for the most part.
Will the spay or neuter be painful for the dog?
So a spay and a neuter is a surgical procedure. We're going to have them under general anesthesia. We're also going to give them perioperative pain control because it is a surgery. If we do our jobs really well, we're going to have your dog very well pre-medicated with pain medications to help alleviate pain. We use local nerve blocks. We're going to use anti-inflammatories. And so by the time we get them through the procedure and into recovery, they should be comfortable, and we should be able to keep them comfortable with go-home post-op pain medications so that they don't have to feel a lot of pain.
Are there any complications to spay or neuter surgeries?
Yeah. So complications with spaying and neutering are rare, but we do see them occasionally. I would say the most common complication that we see would be a dog licking their surgical incision. So we encourage our pet parents when they go home from surgery with us to have a plan in place for if your dog starts to lick their surgical incision. So we're gonna want you to either have an Elizabethan collar or a little Kong collar, which is like almost like a little airline pillow that they wear around their necks, or we might recommend a surgical garment to cover over them. We do t-shirts, we do boxer shorts, we do onesies, something just to protect that incision. So licking the incision and causing trauma to the skin or opening up the skin from removing the surgical glue would be one post-op complication. Another complication would be just infection, just it gets infected. We maybe need to use some antibiotics. Some worse types of post-operative complications in a female would be a girl, would be swelling of the abdominal area. So like just seroma, so fluid underneath the skin would be worse. Maybe some draining fluid out of the incision. And then, of course, the worst complication that I've ever seen would be, we call it dehiscence, so the wound opens up because the dog was often extremely overactive and just very early overactive, and just the incision will break open. That's incredibly rare, and do not worry about that happening. I've only seen it a few times, but it would be a post-operative complication. In our neuters, our little boys, again, licking the surgical site, little boys like to lick their surgical site, so just be prepared for a little boy going home with a post-op neuter to have a plan in place to prevent licking. Another complication could be the scrotal area. So now the testicles have been removed, but the scrotum is still there. So we can see that scrotum becoming like bruised or swollen, especially with a lot of exercise, and maybe even infections getting in that tissue as well. Again, not common, but are post-op complications that we're trying to prevent.
How long on average does a dog spay and neuter take?
Well, it depends on the doctor, of course, and their experience level, but the average time it takes, I mean, it really depends. If you're talking about the time when we have them check in for surgery until they're able to go home, we usually are going to say maybe around 6 hours, but the actual surgery itself may only take a surgeon anywhere from 20 to 30 minutes. If it's a big dog who's been in heat or had puppies, 80-pound female, that might actually take closer to an hour for a doctor to have that procedure done. Neuters, on average, the surgeon time is maybe about 10 to 20 minutes. However, that's the time of the surgery, but the time it takes for us to pre-med your dog, get a catheter in, get it under anesthesia, get it surgically prepped, get it ready for surgery, doctor does its procedure, then get it recovered, that's several hours.
So what's some of the great misconceptions of the spay and neuter process?
So a great misconception is that I need to wait to spay my dog until after it's had its first heat cycle. We actually don't recommend dogs going through estrus cycles, specifically in younger dogs, because we know it can increase their risk of pyometras and breast cancer or mammary tumors. In male dogs, the longer we leave them intact, the more likely they are to develop maybe some behavioral issues, so either aggression or urine marking behaviors. So misconceptions that I get are probably that or it's not safe to have your dog spayed or neutered, so going under general anesthesia, and misconceptions related to that. So we talk a lot through those concerns that clients have, but we really do invite you to ask those specific questions that you have, because we want to clear them up and make you comfortable with the procedure. So if you have questions related to your dog's spay and neutering, we invite you to reach out to Blue Oasis Pet Hospital.